Assalamualaikum and a very good morning, everyone. My name is Afiq Syahmi. I'm a clinical specialist from the University of Malaya. Today we'll be talking about one of the basic fundamental block, which is the femoral nerve block. I'm pretty sure that many of us here are experts with well-equipped knowledge and skill to perform this fundamental block of the femoral nerve block. However, in my experience in dealing with trainees and beginners in regional anesthesia, there are a few tips and tricks that one would often miss, and it makes the performing this femoral nerve block harder than it should be. So we'll be discussing those points, but prior to that, before that, we'll be talking about a bit on the clinical anatomy, the indication, before we go into the video for steps to perform the femoral nerve block. Okay, for the clinical anatomy, as we know that the femoral nerve block comes and originates from the lumbar plexus of L2 to L4. It goes in between the psoas muscle into the pelvic region, and before it comes out more superficially as it travels posterior to the inguinal ligament and lateral to the femoral artery. One key point that to note is that at the point of which lateral to the femoral artery, it will arise at the bifurcation of the femoral artery, giving into smaller branches. Hence, during scanning and injection and needling, one should always visualize the bifurcation of the femoral artery and deliver the medication proximal to that point. As it branches into the anterior and posterior more distally, it innervates all the anterior and medial side of the lower limb, giving innervation to dermatome, myotome, and osteotome. Now, this is one of the more important slide and point one should have knowledge on, the innervations of the femoral nerve. With this knowledge, you would understand further and better in terms of its indication of this femoral nerve block as well as its limitation. For the innervation in terms of dermatome, it will innervate the anterior thigh, and as it goes distally, only the medial aspect of the leg, sparing all the other regions of the dermatome. For myotome, mostly it is covering the extensors of the knee, which is the sartorius and quadriceps, and only those muscles, and does not have any myotomal innervation below the knee. Finally, the osteotome innervation, anterior part of the femur, and as well as the proximal tibia, as well as the distal. So understanding those innervations will help us better in terms of understanding the indication. As you can see from the image previously, the analgesia, it is a good analgesia technique, either a single shot or catheter for many various surgery and trauma, which involves the femur, patella, quadriceps tendon, as well as knee and hip surgery. However, if you would like to perform this femoral nerve block for surgical anesthesia, it should always be done with a combination of other blocks, such as if you are to do a below knee surgery, one should combine this femoral nerve block with at least a popliteal sciatic. And if you will perform an above knee amputation, you should always do it with a combination of also the obturator and lateral femoral cutaneous nerve. And now we will see a short video presentation on how to perform this femoral nerve block. 4 steps in performing this block. The first is positioning. The patient is positioned supine with the inguinal region exposed adequately. The operator should stand on the same side of the block, while the ultrasound system should be on the contralateral side. This allows good ergonomics with the inline view for needling. Step 2 is identification of the anatomical landmark, which in this case is the inguinal crease. The probe should be placed cranially and slightly medial to the inguinal crease. The next step is identifying a few important sonoanatomical structures that will help in the visualization of the femoral nerve. The first structure is the common femoral artery. Slide the ultrasound probe cranially to identify the bifurcation of the femoral artery. This is important as beyond this point, the femoral nerve arises into smaller branches distally. The next structure is the fascia iliaca. It surrounds the nerve on top of the iliopsoas muscle. And finally, the iliopsoas muscle. The femoral nerve lies just on top of this muscle and within the fascia iliaca, lateral to the femoral artery. Be mindful that there could be hyperechoic structures immediately lateral to the femoral artery, and that may be mistaken for the femoral nerve. The fourth step is needling. Needling can be done either in plane or out of plane. In this video, the needle is seen in an in-plane approach towards the femoral nerve. After carefully piercing the fascia iliaca, the local anesthetic is deposited around the nerve following negative aspiration. The use of nerve stimulator and pressure gauge is often advocated in preventing intraneural injection. A total volume of 10 to 15 mL of local anesthetic is adequate for this block. Dynamic scanning can be done to observe the local anesthetic spread surrounding the femoral nerve, which would indicate a successful block. A few tips in performing the femoral nerve block. Number one is avoid hyperechoic structures directly lateral to the artery, usually superficial to the fascia iliaca. The femoral nerve may exhibit anisotropy, hence tilting of the probe may help improve visualization. The use of nerve stimulator and pressure gauge could avoid intraneural injection. And finally, circumferential injection is not often critical in the block success, but it may aid in minimizing the volume of local anesthetic use for this block. Thank you. Performing the femoral nerve block. Okay, in summary, that this femoral nerve block, although being a basic and simple block, remains one of the more important and common block in practice, and it is worthwhile to master and to have a tool in your arsenal of peripheral nerve block. With that, Assalamualaikum, I thank you.